Welcome to the second module of this online learning program provided by Physical and Health Education Canada. In this module, we will focus on the core components of a healthy school. In other words, what are the structures and policies required to become a health-promoting school? In our first session, we focused on why we should adopt a healthy school approach. In this session, we will focus on what is required to become a health-promoting school. What are its core components? So let's quickly review what we have covered so far. In the first module, we discussed why should we adopt a health-promoting schools approach. Global institutions like the WHO point to the evidence that health-promoting schools produce better learners. Recognition of that evidence is fueling interest in a new model for learning success. What does a health-promoting school look like? Two key factors differentiate a health-promoting school. Evidence is used to identify school health priorities and initiatives. Engaging students, staff, parents, and school leadership to plan and implement together. In a health-promoting school, students, school leadership, staff, parents, and community partners collaborate to plan and implement a health-promoting school environment. Evidence shows that the outcome is more engaged and successful learners. So, how do we create a health-promoting school community? What are the components required to develop a health-promoting school approach for your school? The model we will use for our discussion is the Comprehensive School Health Framework, an internationally recognized standard. The framework consists of 4 components: the school's social and physical environment, the teaching and learning approach used, healthy school policy formulation and monitoring, and finally, the partnerships and services created to improve school health. In Canada, the Joint Consortium for School Health, a collaboration of schools across the country, has taken the lead on advancing the Comprehensive School Health Framework. For background on the consortium and the Comprehensive School Health Framework, check out the JCSH website. Just like building a school's physical structure, a healthy school framework must start with a sound foundation. The framework is built on a foundation of awareness about the actual health challenges faced by the school population. The first step is to engage in conversation by asking open-ended questions. What do students see as healthy school priorities? What about parents? What health challenges do school staff and leadership see? What input do our external partners, for example, health partners, provide? What challenges do our students face in the community? This input is crucial to determine the health priorities unique to your school. With that awareness of the health priorities as our foundation, we can start to frame up our healthy school approach. The first wall in our structure is the social and physical environment, what students and staff experience at school. The social environment considers the emotional well-being of staff and students, how each feels about being part of the school. The physical environment includes the school building itself, as well as the outdoor space and equipment in and around the school. These environments are interconnected. Our emotional well-being influences how we see and care for each other and our physical environment. The condition of the physical space influences how we feel about spending time there. A positive social environment exists when children and youth feel informed, are connected to the school community. Social well-being depends on a school environment that is caring, that demonstrates consistent and fair policies that have been developed in collaboration with students. It is a positive environment where families are welcomed with timely access to community resources when they are needed. The physical environment refers to the school's physical surroundings and activities. Good air quality, effective room lighting, appropriate noise levels, and clean surroundings influence how students and staff feel about the school. Access to healthy food options, functioning school equipment, as well as positive health messaging and behaviors create a setting for learning to take place. Our second wall, teaching and learning, refers to how health and wellness topics are integrated into the broader school curriculum. Promoting healthy lifestyle habits includes topics not generally covered in health class and includes skills that extend beyond the classroom. Healthy schools integrate health teaching and learning into other curriculum, such as math, language arts, social studies, focusing on healthy decision-making. Informal, experiential learning is fostered. For example, a school trip for a math class could be grocery shopping for healthy foods purchased based on a specific budget. A healthy cooking class hosted by the grocery store and using the healthy foods purchased provides deeper learning and skill building. The approach provides students and staff with new and fresh ways to experience the value of informal curriculum outside of the classroom. The third support structure is healthy school policies that promote physical, mental, and social wellness practices designed to create lifelong healthy behaviors. To be effective, school health policies must support classroom learning and be applied consistently. Broad input to the development of health policy tends to create shared ownership and commitment to those policies. A school's health policy has been shown to be most effective when it is jointly developed in consultation with the school's community members, educators, school administrators, staff, students and their parents, and community partners. It builds life skills and knowledge that lead to making healthier choices. It provides clear accountability and is applied and is seen to be applied consistently and fairly. Perhaps not surprisingly, meaningful involvement of students in developing health policy has been shown to yield better student adherence. The final structural component of the comprehensive school health framework is partnerships and services. Community members and service groups that have the potential to expand your school's health programming. Families are perhaps the most important partners in working towards a healthy school community, and when welcomed and involved, are valuable resources. Using a strengths-based approach can uncover significant opportunities for parents and families to add value to the school community. For example, a parent with financial skills who manages the finances for the school healthy foods program. When schools act as a hub for community activities ranging from community gardens and nutrition classes to youth group meetings and recreational programs, stronger connections to families and a range of community organizations are nurtured. Finally, what protects and sustains any structure is the roof. Take action and keep the conversation going. Change is constant. Health-promoting schools remain connected and aware of how changes impact each of the four structural components. Optimum results from a health-promoting school approach depend on using input and evidence to define your school's health priorities and integrating all four of these structural components for consistency and continuity. Planning for all four areas ensures the holistic approach required for a successful, comprehensive school health framework. A review of the evidence by the WHO in 2006 found that healthy school approaches can be effective if they are based in evidence and are implemented in a comprehensive, holistic manner. Programs found to be most effective were of long duration, of high intensity, and involved the whole school. There are a number of tools at your disposal to help guide your choice of healthy practices for your school. PHE Canada is compiling a promising practices database outlining successful healthy school program initiatives implemented by schools across Canada. Click on the link to see detailed descriptions of the programs, the schools involved, resources available, and the results achieved. And if your school has a best practice that could help other schools advance their healthy school initiatives, please let us know by contacting PHE Canada. The JCSH also offers rich resources to schools seeking to use a healthy promoting schools approach. The Healthy School Planner is a valuable way to gain insights into your school's current level of readiness. In fact, we have adapted some of the questions from this tool in our reflection questions for this learning program. By clicking on the link, you can register or preview as a guest and work through the foundational module of the Healthy School Planner. This will give you a sense of gaps that your school will need to close in order to build a strong, health-promoting school community. As you move forward with your initiatives, it is important to remember that other organizations are also focused on how best to create a healthy school community. You are not alone. In addition to the support offered by PHE Canada through its Health Promoting School Learning Communities initiative, other valuable resources exist at Healthy Schools BC, OPHEA, and the JCSH, to name just a few other organizations focusing on comprehensive school health. They offer resources and services that will support you in taking action. For more information, check out these links. We have covered the key components required to create a comprehensive school health framework within your school. To plan for a health-promoting school community, we need to use data to identify the unique priority goals and action plans for your school. The following 4 questions are adapted from the Healthy School Planner, a document developed by the University of Waterloo working with the Joint Consortium for School Health. Please take a few moments to reflect on your school's situation. Is your school using information from various sources to drive its school planning and decision-making? Does your Healthy School Action Plan feature SMART goals to ensure focus on specific, measurable, attainable, relevant, and time-specific outcomes? Have you made the case with healthy school community stakeholders that healthier students are better learners? Have you embraced all the components of comprehensive school health within your school's Healthy School Action Plan? If you're using data to inform your efforts, have created SMART goals, and raised the awareness of the link between health and school success, congratulations! You have taken some of the important steps toward establishing a comprehensive school health framework for your school. If you need help with getting started or with expanding your health-promoting school initiative, PHE Canada would like to connect with you. We are ready to help support you in your efforts. For more information, please check out PHE Canada's website to learn more about health-promoting schools. We have shared with you compelling evidence of the vital role that schools can play in creating healthy, productive students who, in turn, help create successful communities. In Module 3, we will share ideas about how to create a health-promoting school community for your school. Thank you for your participation. This e-learning module has been brought to you by Physical and Health Education Canada with the generous financial support of the Lawson Foundation.